All right. I have to tell you what you were just saying there before this commercial break, this last one. That's frightening to even think that they're telling us this information, yet it's still okay to use that stuff when it's really not okay. Frightening. I
Yes,
wonder, like, why do you think that is?
well, there was a great piece in the Guardian, a British investigative journal, like the equivalent of like Frontline. And there have been farmers who have developed Parkinson's disease after working with Paraquat, and they've sued the manufacturer. It turned out, according to the Guardian, they've reviewed legal documents as part of those court cases, and they found that the manufacturer of Paraquat fed Paraquat to mice, to rats, and to rabbits, and they all developed clinical or pathological features of Parkinson's disease.
Oh,
The chemical company did these experiments on rats, mice, and rabbits, according to the Guardian, in the 1960s.
oh,
So that's before I was born. That's over 50 years the chemical company has known that their pesticide, when fed to laboratory animals, 3 mammalian species, produces the features of Parkinson's disease. According to the Guardian, did they seek to withdraw their product? No. Did they seek to introduce a safer alternative? No. They sought to double down on their blockbuster product and engage in a freedom to sell campaign. And that freedom to sell campaign has resulted in Paraquat being sprayed on fields throughout the world, except in the countries that have banned it. Until
oh,
recently, the three countries, according to the Global Burden of Disease Study, that had the highest rates of Parkinson's disease were the United States, Canada, and Argentina. And until I believe 2022, Paraquat was being sprayed in all three of those countries.
oh man. That's disturbing to say the least.
And so this is a campaign. We wrote a piece highlighting that this is we've seen this before. So we the tobacco company did the same thing. They used to advertise that tobacco was healthy, that you would have doctors like
Hmm.
me be in advertisements talking about the health benefits of
Sure.
cigarettes. We've seen the same thing with lead paint. Used to have children being advertised, being used in promotions to extol the benefits of lead-based paint.
Yeah.
These are all my friend and colleague, Professor Amit Ray at Rochester Institute of Technology said, Ray, this is agnotology. And I was like, what in the world is agnotology? And he goes, Ray, agnotology is the deliberate production of ignorance, often for commercial gain. Science, ideally, is the production of knowledge, ideally for the public's good.
Mhm.
Agnotology is the opposite. Agnotology is the production of ignorance, often for commercial gain. And I think we've seen this play out with tobacco. We've seen this play out with leaded paint. We've seen this play out with the opioid crisis. We've seen this
Mhm.
playing out with social media. And I think we're seeing this play out with Paraquat. This is a deliberate, agnotology is a deliberate production of ignorance so that people like you and me, and I wasn't aware of I had no idea about these experiments that the company allegedly was doing in the 1960s. These are deliberate production of ignorance, so we're left in the dark. We're seeing shadows like, Plato's cave. We're seeing those
Sure.
shadows, and we should be really, really concerned if we're seeing shadows when it comes to Paraquat, if we're seeing shadows when it comes to social media, when we see shadows in smoking, what else are we seeing shadows of? And what are other environmental toxicants that are contributing not just to Parkinson's, but to what other brain diseases, to what other cancers? Because there's a reason that life expectancy in the United States today is less than when it was when I was in medical school. It's
Mhm.
less, even though we're smoking less, and even though we spend 50% more on healthcare today than we did when I was in medical school, and life expectancy is less. There are reasons why our health is worse than it has. And I think we need to look and see what's in our environment that's contributing to disease and disability.
Is disturbing as it is to hear this, I am grateful that you're sharing this information because so many will not share this information. And I'm talking not to diss anyone in the medical community or the neurology community, but they won't talk about it or they won't acknowledge it. And this drives me absolutely nuts because we know a lot of this stuff is being suppressed. I'm not a conspiracy theorist kind of guy, but this is not a conspiracy. This is an actual thing that's happening that's being
Well,
squashed down.
listen, I don't think you need to be polite to physicians and researchers. I mean, who's accountable for the rise in Parkinson's disease? If we have a rise in disease, isn't it incumbent on people like me to figure out why it is? Isn't that
Absolutely. I
why,
mean,
we're called doctors?
yeah, yeah.
Isn't this why we give credence and respect to physicians and scientists because they're supposed to dedicate their time and energies and efforts to not only caring for people with the disease, but finding why these diseases increase in their prevalence. We saw in the span in response to the recent COVID-19 pandemic, there were great scientists who did great things to come up with a vaccine that have prevented millions of people from developing COVID and allowed us to resume a life where we can interact with one another in person. I don't take pride in the fact that it's on my watch that the number of people with Parkinson's disease has doubled, right? That means that my colleagues and I are failing in some way, that the status quo is not working. We need to come up with new ways to address Parkinson's disease, new ways to address Alzheimer's disease, new ways to address ALS, because there are reasons why people get these diseases. Maybe it's genetic in some cases, but likely in only a small minority. But there are environmental factors in our food, water, and air that are driving the rise of Parkinson's disease, likely driving the rise of Alzheimer's disease, driving ALS, intellectual disabilities, autism, brain cancer. And we need to figure out what those are and protect the public from those harmful effects.
Well, with that said, we just need more doctors like you, doctor, because you're one of the ones who's taking those initiatives forward. You're putting out the information. You wrote the book. It's a beautiful book. By the way, listeners, it's called, actually, I don't have the full title with me, Ending Parkinson's. Thank you. Ending Parkinson's Disease, a prescription for action, ending Parkinson's disease. And I've read it more than once. I have the printed version, the audio version, because I learn better on audio. And then if I really like something, I buy the printed. So a lot of highlights in my printed version. In fact, we're going to talk about this when we come back from a break. I have a little more talking to do here for a second before we go to break. Funding and policies. I want to hit that when we come back from a short break. And the PACT of the Prevent, Advocate, Care, and Treat. Before we go out to a break, we got about 1 minute left. Can you, would you be willing to share your opinion on exercise? And for example, we know it's good for us. Is it something that people with Parkinson's should be doing? I mean, I know the answer, but I want our listeners to know what you think about this because I think it's so relevant and important and then not emphasized enough.
Yeah, so Sir William Gowers, the father of modern, who wrote the Bible of Neurology in the late 1800s, said that the life of people with Parkinson's disease should be quiet and restful, and he was wrong. So people with Parkinson's disease should be exercising and loud and make their voices heard and sweat a little bit. So we have increasing evidence that exercise is beneficial to people with Parkinson's disease and is associated with a decreased risk of ever developing the disease. So if you have Parkinson's disease, you should be physically active to the extent you can. I routinely recommend my patients exercise at least an hour a day if they could. And I said, if I had Parkinson's disease, I would exercise 2 hours a day. And anything from walking, yoga, tai chi, ballroom dancing, swimming, cycling, boxing without getting your head hit have all been shown to be a benefit in studies. And there are lots of things that people with Parkinson's disease can do to have a higher quality of life today.
Absolutely. All right. Well, thank you, doctor. We're going to come back in a couple of minutes after a news break here. You're listening to Your Health Matters right here in News Radio 570 WSYR, also on 106.9 FM. And we'll be back after this short break.